Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy to understand concepts. What if we could turn the body's immune system into a guided missile against cancer? That's exactly what Linvoseltamab was designed to do. It's a next-generation bispecific antibody therapy, recently granted accelerated FDA approval for relapsed or refractory multiple myeloma. But first, what is multiple myeloma? It is a cancer of plasma cells, the immune cells that produce antibodies to help us fight infection. When these plasma cells become cancerous, they multiply uncontrollably inside the bone marrow, crowding out healthy blood-forming cells. These malignant cells produce large amounts of a single abnormal antibody, known as monoclonal immunoglobulin, or M protein. Unlike normal antibodies, these don't protect us from infection. They are completely useless. They don't recognize or fight infection. It's also important to note that the antibodies don't attack the body's own cells. Multiple myeloma isn't an autoimmune disease. Instead, these abnormal proteins slowly accumulate in the blood and organs over time, where they can clog and damage organs, leading to many of the complications seen in the disease. So, the danger isn't from what these antibodies do. It's from how many of them are made, and where they end up. The hallmark symptoms of multiple myeloma are often remembered with a mnemonic CRAB. C is for calcium elevation. Bone breakdown releases calcium into the blood, causing nausea, confusion, and weakness. R is for renal impairment. M proteins clog the kidneys, leading to kidney damage. A is for anemia. Fewer red blood cells mean fatigue and pallor. And B is for bone lesions. The disease erodes bone tissue, causing pain, fractures, and osteoporosis. Patients may also suffer from frequent infections, nerve pain, and blood thickening due to excess antibodies. Despite many advances, many patients eventually relapse or become resistant to therapy, leaving few effective options. That's where Linvoseltamab comes in. It received accelerated FDA approval in July 2025 for adults with relapsed or refractory multiple myeloma. Linvoseltamab is a bispecific antibody engineered to re-engage the immune system and turn T cells into direct cancer killers. Here's how it works. Linvoseltamab is designed to bind two targets at once. The first is the B-cell maturation antigen, or BCMA on myeloma cells. And second, CD3, a receptor on T cells. By bridging these two cells, Linvoseltamab pulls T cells into direct contact with the cancer cells. This interaction triggers T cells activation, prompting them to release perforin and granzymes, cytotoxic substances that punch holes in and destroy the myeloma cells. Normally, T cells recognize and kill cancer cells on their own, but myeloma can hide from them. Linvoseltamab overcomes this by directly connecting the T cell to the cancer cell, forcing an immune attack. Think of it as reprogramming the immune system's GPS, giving T cells new coordinates to seek out and destroy myeloma cells that were previously invisible. Linvoseltamab's approval was based on results from the Linker-MM1 trial. It included patients with relapsed or refractory multiple myeloma who had received at least 4 prior therapies, including a proteasome inhibitor, an immunomodulatory drug, and an anti-CD38 antibody. In other words, these were heavily pretreated patients with very limited options left. The Linker-MM1 trial was a single-arm, open-label study, meaning all participants received Linvoseltamab. There was no placebo or comparison group. The main outcome measured was the objective response rate. Basically, how many patients showed a clear improvement or remission in their cancer. Results were impressive. 70% of patients responded to treatment. Meaning, about 7 out of every 10 patients saw their disease improve. Even better, the responses were durable. 89% of responders maintained their response after 9 months, and 72% were still responding after 12 months. To put it simply, linvoseltamab's not only worked, its effects lasted. The most common side effects observed were cytokine release syndrome, fatigue, anemia, and infections, which were generally manageable with standard supportive care. In summary, linvoseltamab works by redirecting and reactivating the body's own immune system to attack myeloma cells. By linking BCMA and CD3, it bypasses tumors' immune evasion and reawakens exhausted T cells, offering new hope for patients who have exhausted other treatment options. A therapy that truly turns the immune system into a guided missile against cancer. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.